release that the International Council of Active Aging did on the gap between consumer expectations and what is actually offered in senior living, I immediately reached out to my friend Colin Milner and said, we got to have a discussion on this, because I think those of us who are in the field of senior living recognize that there's a gap there. And I think having some kind of research to kind of have a conversation around this topic is really important. And folks, I want to make sure, one thing that I didn't tell you, the best part about our discussions is they're live and interactive. So you can make comments, you can ask questions. We want to kind of hear your voice on this topic, as well as Colin is sharing his resources. So feel free to use chat, feel free to use the Q&A, and feel free to raise your little virtual hand if you'd like to jump in to the discussion today on what I think is one of the most important topics out there, is that gap between expectation and reality. But Colin, thanks for joining us from the our neighbor to the north. I believe you're up in Canada. Are you there today?
I am in Canada and in Vancouver, the beautiful city of Vancouver, and we are back to our normal rain. So it's good to be indoors.
I love it. Now Colin, before we dive into this research project and really start having what I think is going to be an awesome conversation around this topic, let's get to know you a little bit better. Tell folks a little bit about yourself and the International Council on Active Aging. And I got your website all loaded up if you want to give us a tour there.
So, I've been in the health and wellness field. Oh my goodness, this is actually year 40. So I've been in it longer than almost my two kids combined together. And I got into it because I was going to be a professional football player or soccer player, and went to where was my home country at the time, Jamaica. Went back to it. I know you would not. I went to bed at the bar. And the reality is I came back, carrying some extra weight, got into a fitness club, started to lose the weight, and got offered a job. So that's where everything started. And what I noticed quickly is how quickly we can transform ourselves just simply by moving and being engaged in life. And, 20 years later, I launched the ICAA, which is the International Council on Active Aging, with a very simple goal, and that is to help change the way we age. And if you remember, Steve, back then, almost all the conversation around aging was negative. Mm-hmm. It was about how Medicare was going to get bankrupt and how older adults were a burden to society. Still, there's a lot of that conversation, but it's a lot more balanced now. And, it's my belief that if we can help people to live better longer, we can not only impact their quality of life, but we can start to erode ageism. And that really has been our goal. And 22 years later, we are providing education, information, resources, and tools to 10,000 senior living communities in 57 countries.
Man, I love it. And, the last time I had you on here, I must have missed this Jamaica pro football story. I think every time I have you on, Colin, I'm going to learn something new. You're obviously, I like teasing you, and I hope I'm not the only one who says that you are a dead ringer for Drew Carey. I feel like I'm.
No, I've never heard that before. Come on.
Out of curiosity, have you played around? Have you ever taken an improv class out of curiosity?
No, but it's funny because I was doing a presentation in Arizona years and years ago, and in the room was the owner of I think it was a comedy shop or a comedy factory or whatever it was, and he walked up to me afterwards and said, "You're a funny guy." He says, you remind me of I forget who it was, But I remember thinking, I don't like that guy, not him, but the comedian. Anyway, he said, you should get into comedy. And
Yeah.
here
Well,
we are.
yep. Okay. Well,
But this research is no joke.
No. See, man, you're awesome, Drew. I mean, sorry, Colin. So okay, let's dive into this. I mean, I am now. Okay, so you all issued a report. I'll find it on the website and make sure that I send out the link to everybody. But the first thing is, to my knowledge, I had never heard of anybody doing a report on the expectations and the offerings. What led to you sort of looking at this research project?
It's a great question, and I just got tired of reading just one side of the picture at once. So we came together with our partners on the project, Age of Majority, and said, wouldn't it be great if we could actually ask the industry what we think of ourselves and what we think our residents think of our properties, and then ask people who are prospective residents coming in what they think, and is there a gap, and do we need to close those gaps to really truly meet the needs of the population? And we missed one group, and that was the people living in residences, which that would have been a nice trifecta, but we thought it may be just too much. So we wanted to look more so at people who want to move into a community or are at least available for the conversation. So yeah, to my knowledge, it was the first of its kind. I'd not heard of it, and I tried to find something that was comparable to it and couldn't.
Okay, so and I guess when you talk about the partners, I was not familiar with this organization. That your partner in the study is the Age of Majority. Tell me a little bit about that organization. Okay, they're a research.
They are.
Okay, so this was a very methodical, wasn't sort of a man on the street thing. You guys really dove into this with very research focused.
Yes, as we always have. And, our goal is, we're apolitical when it comes to research. Our goal is just simply to report the findings and then to look at those findings and interpret what they mean and how we can better the industry and move ourselves forward. It's as simple as that. We have no agenda. And as they say, our goal really is very simple, Stephen. That is, how do we help all of those on this call better understand what our challenges are and what our opportunities are?
All right.
That's it.
I love it. And I think it's very sometimes doing research like this or hearing the results can be very hard for people in our industry to absorb, because we all work so hard and we're all so well intentioned. To think that there's a gap that's out there is sort of like, what do you mean? But I actually look at it to think that there's not a gap out there doesn't push us to deliver, better service or what have you. So let's kind of dive into when the dust was all settled, what are some of the key findings of the report in terms of this gap?
Well, I think number one, there's a gap in every industry and every business. Our goal has got to be, we have great aspirations, and sometimes implementation isn't as wonderful as we think. So how do we close that gap to move forward? So when we looked at this, we were looking at it through that lens. How do we actually close these gaps? And to me, the number one thing that jumped out from all of this was the perception gap. Now, I think a lot of us know that we've had a challenge. People view senior living through one lens, and that is that, I'm going to come in, I'm going to move into the community, and I'm there because I have a need, and I'm moving in much later nowadays with more acute conditions. The question is, how do we change that? How do we get people in earlier, help them to live better longer, stay longer because they are healthier, and it's just good for business and good for them. And the reality is that many of us, our current product is not viewed as something that is lifestyle based, even if we are, because of years of what our industry has been. However, we are shifting. And I think if we can address the perceptions gap with one word, autonomy. So think about it this way. Why do I stay in my home? Because I believe it's because I can do what I want, when I want, with who I want, and no one is telling me what to do. So I think the big thing that came out of the study for me was autonomous living. And to get there, we need to close the gap of perceptions. And that is, moving forward, we need to provide an environment where people can do just what they do at home. I can be able to do the things I'm not coming down for dinner at a certain time because I want dinner at another time. I want to be able to go where I want, when I want. I don't want to have to rely on that I can only do that with a trip, as an example, with a group. All of these kinds of things that perceptually, I'm losing my autonomy, where we can change that by helping to visualize how we give people back their autonomy. And that all starts with perceptions.
Man, and in this field, because we are fighting so many perceptions of, a person's vision of a nursing home 20, 30 years ago, where they visited someone, and then the reality of maybe the environment that they're going in. But I think there's also, I feel like this is really challenging for marketers, in that a community that is offering autonomy, but it's sort of like, if you're marketing to the children of somebody who is concerned about mom and dad, what they want to hear is, oh, they can do all the stuff at this place that I'm doing for mom and dad. And it just gets really messy, doesn't it?
Well, it does, depending how we also handle it. So let's just pivot for a second to the dementia village in the Netherlands.
Oh, I love that model. And I'll drop that into chat for folks that aren't familiar with it.
If you look at what makes that a unique property, is that they have gone out of their way to normalize life in the community. If you want to leave the community and go for a bike ride with one of the people that works at the community, your kids may not be a fan of that, but you are adding to the quality of life of that individual, and it's supervised and so forth. So at some stage, we have to give something up to get. And the question is what we get more than what we give up? And I think what we get is way more than what we give up. What we give up is somebody controlling what I'm doing, and I'm not saying that in a negative way. It's just the way it is. What I get is I get the feeling of freedom. I get the feeling of autonomy. I get the feeling of control. And that may be assisted. I have someone, depending on what level of care somebody is in currently, I may have someone that comes with me on that or not. So I think we just need to rethink how we deliver things as opposed to just status quo.
And since you brought up the Dementia Village, I dropped this link into chat, but I love sharing this concept with folks. If you're not familiar with this, what you can see on the screen is actually a village that has multiple homes in it. I love this concept of there's a grocery store, and instead of a secure memory care community building, that there are intentionally designed homes in neighborhoods so that and I remember the first time that I really learned about this. I was at a conference where one of the founders of this concept was, and he said to all of us professionals in this conference room, he said, if I lock these doors and we had to stay in this room for the next 2 days, I think a lot of you would start exhibiting the behavior that many of our parents exhibit when we are sort of locked in a secure dementia building or residence. Whereas imagine it's a rainy day and I want to put my raincoat on and go out and walk in the rain. You can do that at the Dementia Village in the Netherlands.
Well, and that brings us back to perception. What is the perception of a memory care community? What is the perception of senior living? I'll give you an example. Some of the results from our survey showed that we think that we are an entertaining place. We provide entertainment. 64% of those that answered the survey, man, we are hot. We provide entertainment. We are great. 11% of people that are over 50 believe that communities are entertaining. Wow. So there is a 53 percentage point gap. Now, I don't know about you, but in anybody's book, that needs to be looked at. And we just talked about autonomy. 75% of communities believe that they are safe. That, hey, we provide an environment that is safe. You can do all these different things. Only 30% of the consumer that was surveyed believe so. So that's a 45 percentage point gap. These aren't small gaps. These are huge, huge gaps.
Man, well, let's kind of dive into those two things. So entertainment and what. And I love some of the rebranding that folks are doing in our field in the space of, what is traditionally been called activities, to make it more enticing and to make it, hopefully bridge some of that gap. But this is an area of perception versus reality. And oftentimes perception can be, you go there and you play bingo. And I know that there was a movement many years ago beyond bingo, whereas some residents have sort of abandoned bingo. And when somebody comes in and says, hey, do you guys play bingo? It's like, no, we don't do that. It's like, well, I kind of like playing bingo. It goes to autonomy.
It goes to autonomy and diversity. There is no one size fits all community. There's no one size fits all resident. What you need to understand is, what does your current makeup of residents want, need, and also what does your future resident want and need? And unless you truly are a student of aging and your population, you're going to miss the needle all the time. So to me, it's really sitting down with people, finding out what they aspire to. We all know what some people's needs are around functional capabilities and all of this, but what do people aspire to? What is their current identity, and what do they want their future identity to be, and work backwards to figure out how you can help them to get there. I think that we have a challenge in things like behavior change until we change, or people change their identity, because if I don't see myself as an exerciser, I'm not going to change my behavior. I need to see myself moving forward as someone that wants to travel, someone that wants to do whatever it is, and work backwards to get there.
Man, I love that. And it's really, I think it's a conversation between the provider, whether it be a community or in-home provider, and the individual client, and customizing it. Well, Colin, you opened the door on safety, and we've got a bunch of questions on that topic. Lewis says, great help in understanding how would it feel to be locked in here for 2 days. But let me read you a couple of these. Adele says, why aren't there dementia villages in the US instead of lockdown units? And Adele, I think that is a great example of perception and reality. Is perception is this is a lockdown unit, but if, as consumers, if we really understood what is being delivered at some of these communities, it's far from being a lockdown unit. And I say some, there's obviously underliers, but do you find that in your study, this sort of perception of lockdown unit and secure unit is contributing to one of the gaps that is out there?
Well, think about, memory care as an example. It used to be wards, and that you were senile. So part of our change over time has been language. We have dressed things up, and no one wants to be in lockdown. We've experienced that with COVID, and we've seen the impact on mental health. We've seen it on functional capabilities. We've seen it on all of these different things. So absolutely, I think, how do you create an environment that, yes, it is safe for an individual, but let's say if you have these walls around you, but everything on the inside of that wall doesn't feel like it's in a lockdown state. It's perception. And that is, if you look at the dementia village in the Netherlands, the reality is they have walls around the whole community. It's just simply how they designed it.
Yeah, exactly. And in fairness to some of the innovative design that's out there in the States, there's a lot of vast outdoor spaces and things of that nature that are much better than what was out there in 20, 30 years ago, for residents to feel like they have freedom.
Oh, absolutely. I mean, I remember going into a community, and first I walked in and I went, wow, this feels like a Motel 6. And I walked from the lobby into the courtyard, and it was all rooms turned inwards. And it was literally like, I hate to say it, but prison.
Mm-hmm.
All the rooms were looking into the small courtyard, and that was it. Blew me away. Today, you go into communities, and many of them are beautiful. They're decked out. It's a very different world. And I think that what we're seeing right now, Steve, is that people are trying new models because we know that we need to change. Okay, so what's happened over the years? You alluded to it. We've seen changes in the name, taking out retirement, taking out senior living, having more generalized names. We see some of the marketing changing. A lot of websites haven't changed that much. If you look at it, I think let's call a spade a spade. We need to do a little bit better on our websites. But when you look at the programming and so forth, we are definitely making strides forward. We now have things like, wellness directors, VPs of wellness. Some have wellness CEOs. We talk about engagement. Well, when we talk about engagement, my only pushback there is show me your engagement strategy, because I think we use the term very loosely. We are an engagement department and an engagement professional, but show me an engagement certification, show me an engagement strategy. Our goal is to engage people, but I think, the marketers get in the way sometimes. But if you also look at what we're doing with the communities, we now have more intergenerational communities. You have middle market. You have now the university, more and more focus on the university projects. You have pocket neighborhoods. You have themed communities like the new Disney one that is opening up, which, by the way, people forget. Disney opened up a community probably about 25 years ago in Orlando. You have communal living, CCRC Light, villages, multi-generational, wellness communities. What that screams to me is that people are looking for a solution and we're not sure what it is. It also says that the market is extremely diverse and we need multiple solutions, not just one.
I love it. And folks, it looks like there are a few Disney communities that are out there, but I tell you, I used to call sort of these enthusiast-based communities, the Margaritaville centered around Jimmy Buffett, rest in peace, is a community that's age segregated, but the age segregation is not the focal point. It's, Jimmy Buffett. And it's like now you're attracting Jimmy Buffett fans or people that are fans of that lifestyle to a community together versus this is just a place for people to live over the age of 55.
Hey, think about what it's going to be like if we have biker communities. Oh, yeah. My goodness.
Yep.
The Hells Angels need somewhere to retire. Okay.
Oh, no, I love it. Now let's see, back to the safety. Wendy has a great question here. She says, what do you mean by perceived to be safe? Physical safety at the residence or safe in economic terms, assurance the place won't be sold to private equity and go out of business? Good question there that we could probably talk an hour about, but what are some thoughts on that term safety?
I think from the perception of the individual, it's safe to be in the community. Number one is, is the building itself safe, especially if it's a needs-driven thing. Am I going to get the assistance or the care that I need? Is the building locked down to the outside as an example, where people won't be able to come in the evenings, or elements like that? But I think it really is it safe for me to be in that building? And from a perceptual standpoint, I think a lot of that searching answer is probably more around a needs-driven, where things like falls and all these other elements are taken into place.
Okay, great. A question from Elva about she said that there's a dementia village that's set to open in Canada. And I did a quick search and found Canada's publicly funded dementia village is set to open next year. Do you have any, you're being a Canadian or living in Canada there, Colin, do you have any details on that project?
That project, to my knowledge, because I actually got interviewed by the media when they were looking at opening it up. It's, if my memory is correct, it's in Langley. I may be misinformed there, but I believe it's in Langley, BC. And they were trying to mimic very much so the model that is the dementia village. As a matter of fact, I believe that the person that is running it was involved in the dementia village in the first place. Okay, and Rose says Langley, BC is private, run by Verve. It's actually rather costly. So let me ask you, there's not much that isn't rather costly. Yeah. Nowadays, My wife and I just, her mother was in a community for a few months, and it kind of blew us away. So I think that that's the other part of all of this is, we didn't ask about dollars and cents, but it would be interesting to find out what individuals' feelings on that were. We certainly know that, we think our communities are very vibrant and healthy, but only 5% of those who answered the survey believe that communities are vibrant, and 10% believe that, they're healthy in what they deliver.
Man, these are great talking points. And folks, I'm just trying to throw in, this is a big soup discussion here, so keep them coming. But I'm glad my friend Leah Daly, it says, thinking about autonomous living, let's think about dining. Were you able to extract specifics on what people were looking for when it came to senior living and dining desires? And I after you throw in your 2 cents, I had a conversation this morning on this that I'd like to share. Any details on dining and autonomy and things like that?
So now you're saying dining as opposed to dying.
Yeah, dining, eating.
Yeah.
Eating,
Oh,
yes.
okay. Just wanted to make sure, because we also need to focus on dying well. So we didn't ask about dining, but I can tell you, just prior to the COVID-19 pandemic, we had surveyed our members for 3 years in a row. The number one thing that was in development from our members was cafes. And I believe that part of that is more grab and go, people, the autonomy, on the move, getting out there, and being able to grab something at any time. Did we ask about dining specifically? No.
Leah, I'm glad you brought this question up, because this morning I was at an event, and providers were talking about challenges, and one of the communities was citing, we all know that there's this labor shortage, and the labor shortage is oftentimes focused on the caregivers, the direct care providers. But she was sharing the challenge in dining services she feels is even greater. And because if somebody's experience in the dining room is not to their expectations, it can really be exponential in terms of their perception and their pleasure in living in that community. And I like to compare things to take things out of senior living. And we had a great discussion on how many times do you run into a neighbor or a friend who goes to a restaurant one time, not the one they go to every day, and if the food is not served in a timely manner, or if it's not correct or what have you, that can sour them on that restaurant experience for months, if not years. And here are our residents, the power of a negative expectation and reality in the community that they're living in can really wreak havoc on that gap too.
Oh, I think, the old saying, those are all moments of truth. And at the end of the day, our goal is to make those positive moments. The other part of that is, do we open up our dining to the outside, which we have seen that 35% of people who answered our surveys are opening up their communities to the outside to come in and use their wellness centers, their fitness centers, their on-site dining, and all of these other things. And that is a wonderful way to get people in. It's a wonderful way for a lead generator, but it's also a wonderful way to turn people off if what you offer isn't equivalent to what you get on the outside of your community. And I believe communities today need to be a reflection of society as opposed to exclusive to what we think people want.
Yeah. And We've got some other questions here, but you sort of pushed a little hot button that I often have conversations with when folks are shopping for a community. Oftentimes I'll have this with an adult child where mom just doesn't want to leave and go to the community. She sees the value. And I often, when you talk about a reflection on society, I say, look, think about it this way. Mom lives on a street or in a community right now that is not segregated in any way. Black, white, married, single, divorced, young, old, live on her street. And now we're introducing a segregated living, which is to benefit mom, but it's segregated in that young people can't live in this community that you're moving into. And that sort of reflection on society can oftentimes be something that puts the brakes on us when we're considering a move.
Well, I'll tell you, Willow Valley, years ago, when I interviewed John Swanson there, I thought he did a brilliant thing, and that was that they opened up a new section of the community, and that section had pinball. That section had bowling alleys. They had the pool, which is traditional. We have a pool, and you can have the grandkids come over, but it became such a cool place to be that they were hosting summer camps there. And that the kids actually wanted to come into the community to spend time with their grandparents, as opposed to when I was growing up. Me, I don't want to go see my grandparents there. It's a depressing place. A very, very different environment.
Yeah, and I think there are some just great innovations that are out there. We've gone leaps and bounds. And when I say age segregated, I mean, it's segregated because we're creating an environment to make life more purposeful and engaging for, a segment of the population. But the steps that communities have done to include all generations in the lifestyle is insurmountable changes in the last few years. I want to open the door here. We open the door. Rose says, which brings us to discuss affordability of these services and places. Our wider and regular older adults are not able to access them as a result, unfortunately. And I think I'll drop it in the chat. One of the big things that we're talking about lately is the forgotten middle. Is that we've created options for the lowest income. We've created options for what may be the highest incomes, but whether it's perception or reality, this group in between feels left out in terms of choices sometimes. Any thoughts on that, Colin?
I mean, I think you have that with every business, is who are you serving? So let's use as an example, we had a think tank of 50 thought leaders that came together to talk about the middle market about a year ago. And the term care came up once in the whole conversation, because care is where most of the cost comes in. So, the belief was that you would have on your property a concierge service. This is just one of the many recommendations, a concierge service that lines you up with the different services that you want. You maybe have on-site dining or not. You have on-site wellness programs, or you work with someone in the community right by you. As far as care goes, you have a room that you have decked out that a doctor on call can come in and work with a resident, or that you can do telehealth in that, but that is not the primary purpose of the community. Also the topic was not including the middle market under the general term senior living, because are we then restricting what people view the market or the properties as? So, it was a very, very different conversation. It was more engaged with your neighbors, your neighborhood. And to be frank, it's no different than where I live. And that is that I'm at the base of the city, I'm engaged with the city, and I'm moving in because I have functional capabilities that enable me to live there. Once I lose those functional capabilities, if I do need care, then I have to move somewhere else. And that's, that was the general consensus among the individuals of what they were looking at for the future of the middle market. That's simplified in 60 seconds.
Yeah. Yeah. Now let's talk about Donna brings up a good talking point, and it's the lack of main level living options she's in Northern Virginia, but I think this is a nationwide problem is that we've built homes that have accessibility issues, and we are doing our best to promote people changing those before you need those, or throwing duct tape on the problem. But any thoughts on that, Colin?
So I think there are two ways. There's always multiple ways of looking at things, but I think there's two ways of looking at things. One is, what are people going to need? 20% of the population, as an example, needs some form of assistance, generally 20%. So yes, but are we also enabling people by not helping them to stay stronger longer, as an example, so that they can walk up and down those stairs without any issues, and that lighting is better so that they can view that? So some people will say, well, we are limiting people because when they get out of their house, they're going to have to walk upstairs. They're going to have to be engaged in the rest of society. So you want to keep individuals strong and able to navigate. And then others, of course, let's make everything one floor so we reduce any of the issues. I think it's probably somewhere in between. But yes, you want to make sure that your house is planned for and you are prepared. But at the same time, you want to make sure that you are able to navigate the outside. Think about all the people who go and travel. Okay. And I can tell you, I've been to 57 different countries for my role with the ICAA. You go to Europe, you're walking up and down stairs, a lot of stairs. You go to China, you want to see the Great Wall of China. Oh, you got to be fit. Okay. The reality is that we need to be healthy and fit to navigate society, and our house is just part of that.
Mm-hmm. Really good thoughts on that. And as I'm looking at the clock, I knew this was going to go by really quick. I want to make sure we can dive into a bunch of different topics, but I wanted to make sure that you had the opportunity to tell us, are there any other sort of things that jumped out of this report on the gap between expectations and reality that we haven't addressed yet? And I just noticed also, I got Suzanne and Ruth raising their hands. They may have questions, but Colin, any other sort of segments of the report that we haven't talked about?
Yeah, so we have done, as we always do, multiple research studies with our members, and now 61% of our members believe in the next 5 years that they will move from a care-based community with wellness to a wellness-based community with care. That's being driven by the fact that 79% of those who responded believe that wellness is now essential. And that's a 55% increase since 2019. Now, I bring this up because our perceptions of what a community is will impact what we build, or that's the thought. But the reality is we're going in a way that would enhance these perceptions. I think that the challenge is that the individual's views, a lot of those may be because they haven't come into the community. So one of the things that as we build these communities that are more lifestyle oriented, our challenge is going to be getting people in to experience the community, which is the opening to the public, as opposed to just our general marketing, because the general marketing certainly hasn't done it as far as perceptions go. So I think we're going to have that challenge for a while, unless we start drawing people in and becoming part of your overall community. And by doing so, you start to increase things like the socialization of the community. 89% of people that worked in the communities believe that the communities are social. I know that when my mom and my grandmother moved in, huge difference to their social connections. However, people 50 plus who maybe haven't moved in, only 40% of them see a community as a social place. Maybe it's because they think it's a place that's needs driven and not lifestyle oriented. And needs driven can be highly social as well. So, that's 49 percentage point gap.
Well, and I will tell on that one, some folks on here may realize I'm 57 now, but when I was 43, I moved in and I lived temporarily in 5 different communities. And I have to say, when I would come home from these temporary moves, even though I came home to my family on my suburban street, I felt very, I felt very lonely. I felt like, when I was in these communities, these were the most engaged neighborhoods that I had ever spent time in, because I had so many people around me, and it was just really one of those, for me, one of those perception reality things. Some more questions here. Okay. Judy has a question on the report. I shared the press release, but I can't, I was trying to navigate where on the website we can find this actual report.
White papers. Go under the report section. Yeah, research, and then go over to white papers.
Okay.
We put it under white papers because all the things under our reports are actually, you pay for them. We opened this up and made it available. So it's one on the right side.
Okay.
Yeah.
Okay. And then, yep, it's in PDF here. And so here, what I'm going to do, let me just share this link, folks, with the white papers. And I'll share that with y'all so that you can check out this report. And I'll make sure on the recording link to put a real easy to access link to get that as well. Elizabeth asks, what did consumers have to say about the availability and quality of home care in the independent living communities, not the assisted living sections? I think you were sort of alluding to that in terms of how to address the middle market, right? It's kind of like, hey, we'll create housing and then you bring in the services. But do you want to elaborate on that, or can you elaborate on that at all?
Yeah, so I would say that there are a couple of things to look at in regards to all of this, and that is, what is home care? So I bring that up as an example because years ago, where I live, I was doing some advising for the government, and they were talking all about home care, and someone coming in and doing your bed and cleaning your dishes, and help assisting you. And I asked them, well, why aren't you sending in a therapist or a personal trainer to help people become stronger so that they don't need the care? If someone is able to restore their capabilities, there's always cases that they aren't. And they just simply said, well, that's not our model. And I thought to myself, that's a really poor answer. Our goal has got to be able to help people to earn their health span. And to do that means moving, doing things. And when somebody is in lockdown mode, in some instances, they're not. Now, I want you to think about this research study that came out from Deloitte's in 2021 that basically says in 2019, about 80% of our health spending went to care and treatment. Their prediction is by 2040, we can expect to see 60% of the spending go towards improving health and well-being. My point is that even the home care model needs to change. We need to empower individuals, and the money is going to be there to help you do it. And another study by Deloitte also mentioned by 2040 that the center of the care model would be the individual, not the community and not the healthcare setting, but the individual, because technology will enable them to make many of the choices themselves, especially if we're monitoring people all the way through and catching small changes before they become big issues. So as we wind down, I want people to think about one very simple thing. At the age of 50, if we simply do 5 things, never don't smoke, don't drink, exercise, have a good BMI, and eat properly, we can expand our life expectancy by 19 years for women and 14 years for men. Dr. Kenneth Cooper, at our conference showed that by doing very similar things, and he's a great researcher in the area of fitness and wellness, that his customers were living, well beyond the average life expectancy into their 90s, and then they were just dying. They didn't have 8, 9, 10 years of ill health. So think about this, and that is, what is a healthier older adult going to mean to the industry when people are coming in later with more acute conditions? Does it mean that they're now going to be coming in their 90s with the acute condition, if they have an acute condition? Now, that's a generalization because there's always going to be people with acute conditions. But does that mean that people are going to be coming in later, as we have seen the trend with more acute conditions? And are you wanting to be prepared for that piece of business, or are you wanting to help people to manage their own health and wellness early on so that they can live better longer and then just pass away quicker?
Man, yeah. I mean, these are all just thought-provoking ideas and concepts that we all need to keep in the back of our minds. And then we also need to recognize, as we've seen, as we're living longer, this just cognitive impairment is just the heart-wrenching thing that none of us have a crystal ball, and it's so difficult to support and care for folks with cognitive disorders.
I think that is the biggest challenge, because many people, we can restore their physical function. The cognitive part. I mean, you think about it, we can, if we over the next 2 decades utilized the interventions that we currently have, such as not smoking, not drinking, all these things, we could reduce the global burden of chronic health disease and disease by 40%, adding $12 trillion to the GDP. Now, the problem is not all disease is equal. So, we can do all of that, but there's still a huge issue with the cognitive impairment that is going to have a impact. And, I have 3 people that have just gone through that experience and it passed on, and it's not a pleasant one.
Okay. I know we're going to be winding down here. I want to get some your thoughts on Ruth's question, because we've sort of spotlighted the dementia village in Canada and Europe. And she asks, who's doing a great job in the US but just in general? I mean, I love the dementia village model, and somebody commented the name dementia village is probably not the most appealing, but yeah. What are some of the exciting things that you've seen out there, Colin, that represents trying to close that gap between expectations and reality?
I think there's a lot of great things going on. You have Enso Village, which a lot of people probably refer to now. It's a Zen-inspired senior living community by Kendall. If you look at their website when they talk about care. It's with a well care perspective when they talk about the rest of the community. It is a place that you come, if like Jimmy Buffett's, if you are someone that is spiritually inclined, you want to study with the Buddhists or monk or what have you. You have someone like Chip Conley, who has been involved with Airbnb, who is opening up a community all around regeneration. And the focus is to help people to regenerate themselves, to restore a better, higher, and more worthy state, should we say, spiritually reborn or converted, but also to help regenerate the land around you. You have Disney, as I mentioned, that is opening up. And I think what's going to be really interesting to look at Disney, forget the name Disney. I think what is going to be really interesting is to look at what kind of experiences they create, because Disney is known for their experiences. Now, it's the Disney brand, but it's DMB that is actually running the communities. Same with Jimmy Buffett. Jimmy Buffett was, I think it's, I forget the name of the communities that are actually creating the Jimmy Buffett communities. So I think in my mind, it's all about experience. How do we create these positive experiences? And there are lots of great examples out there of people doing it. There's fewer examples of people doing everything perfectly, but I think you're always going to have that challenge. But they are some great examples to look at. You can look at, the new Blue Zones community that's going up in Miami, in their focus. I think that they're going to provide a new, exciting, project to look at, especially from an assessment. Their whole focus is on personalization. So check them out. There's a lot of good stuff happening. We just need a lot more.
Yeah, and I think that you've really shared with me some things that I was not aware of, and I'll make sure to add these links that I pulled up into the recording. But I think that if we can start getting more of these examples out there, that gap can start shrinking. But it's
absolutely
just going to take time, like everything. Let me do a quick glance and then we'll wrap things up, folks. But Colin, I'd love to have you back on to dive into this deeper. And I really feel like I could see an annual or biannual update to this report that you put together, like you said, and doing some polling of the residents as well. Let's see. Susan talks about people fear of outliving their money. I think this is, again, there's some pros on longevity, but there's some cons too, is that funding 40 years of retirement or whatever you want to call it when you didn't even work 40 years is a challenge that we're all faced with.
$2,100, Steve. If you walk 150 minutes a week, you can save $2,100 a month on your healthcare bills.
This is a great cost savings thing. Lewis says, I remember having a relevant, okay, let's see. Opus Newton is another one that somebody cites. I'll make sure that that's in chat. Anyways, everybody's saying this was a great discussion. Let's not finish it here. Colin, did you refer to a doctor at any point in time? Somebody was asking the doctor's name. Do you recall that? I don't recall that. It may have been something, but
Dr. Kenneth Cooper.
Dr. Kenneth Cooper.
Okay. Yeah, Dr. Kenneth Cooper with the Cooper Institute. He's grandfather of aerobics. He has done, probably more research on physical activity than most people that I've heard of or know. I think he has a database of about 300,000 people, and he has this program called Coopersize. If you Cooperize, if you are Cooperized, your odds are that you live better, longer. it's Steve, we can leave people with this simple thought, and that is it's not difficult. Move, eat well, be connected with people, think about more than yourself. And, a lot of the rest begins to fall into place.
Oh, I love it. Colin, this is a thrill always, connecting with you, and I look forward to our next discussion. And I'm closely monitoring your press releases and reports because I know you're going to have something awesome that pops up on the radar. But feel free to reach out if you ever, want to join us again to talk about anything on your wide variety of topics that the International Council on Active Aging is addressing.
It would be my pleasure anytime.
I love it. All right, folks, we'll see you at the next one, and have a great rest of the day.
Thank you, everyone.